Hi guys, I'm outside of the Cleveland Clinic here in Weston, and I've got an update for you about my surgery that was a little over 2 months ago. I'm walking back to my car here, and I just met with my surgeon, and he has some good news. He said that my tendon is healing very well, my Achilles. He examined it with an ultrasound. The tear, I had a really bad tear that they targeted with PRP, and the tear is healing. He said that my tendon is healing very well, my Achilles. He examined it with an ultrasound because I'm 9 weeks post-surgery almost. The tear, I had a really bad tear that they targeted with the PRP was 7 weeks ago, and the tear is healing. He said that my tendon is healing very well, my Achilles. Very nicely. He examined it with an ultrasound. Always going to have a bulge. The tear, I had a really bad tear that they targeted. So much marathoning in my life called PRP, and the tear is healing. That my tendon is healing very well. A lot of tissue and shave it down during surgery. Always going to have, and I did clean up a lot of that area. I had a really bad tear that they targeted with tissue that was causing tension to be pinched. And the tendon is much more functional now. I'm able to go up on my toes and do a squat. I'm able to do a two-legged calf, toe raise. He had me do the doctor a couple of exercises. Much more functional now. I'm able to get in my car so I can talk to you guys. Sorry I'm a little late, but what happened was two-legged calf, toe raise. I actually had to wait about 2 hours. He had me do the doctor a couple of exercises. I got in the car so I can talk to you guys. I thought I was sorry I'm a little late, but what happened was two-legged. It gets seen about 2 hours after I got there. We actually had to wait. That's life. And the doctor read a couple of exercises. I got in the car so I can talk to you guys. I thought I was sorry I'm a little late about the time today. Last time I didn't get seen about 2 hours after we did an examination. That's years ago. Ultrasound and x-rays. Last time I'm a little late about the time today. Last time I did 2 weeks about 2 hours. I examined Oxycam 4 years ago. Ultrasound, Oxycam is a powerful anti-inflammatory prescription drug. Joint injuries. And 1 second, guys. 1 second, okay, that was weird. My phone in my car is causing there to be feedback. I'm turning on the AC so I can talk to you. Let me turn off the Bluetooth. Okay, I think that's better. So yeah, I have good news. I can get on the elliptical machine when I'm ready, as in this weekend. I'm traveling to Chicago tomorrow, to Madison, Wisconsin to see my family, and I may take a little meloxicam this weekend because I have a triggered knee issue, and I'm going to be getting an MRI on my knee, believe it or not, on my right knee, the same knee that got hit by the truck last year in the bike accident. It's been inflamed for the last couple of days for no reason. I didn't hurt it, I didn't bang it, I didn't do anything or I wasn't too strenuous. And I saw my physical therapist today, my chiropractor. He adjusted me. Shout out to Dr. Dylan at Healing Hands in Cooper City. And I have patellar tendonitis in my right knee, and I had to take the meloxicam this morning for the first time in like a week because I couldn't bend my knee. And I've had really bad allergies for the last 2 or 3 weeks. And besides that, the Achilles is doing really good. It's still slightly inflamed. It's never going to be probably a perfect Achilles tendon again, but it's in so much better shape than it was pre-surgery. The doctor's excited. He wants to see me get back to training so I can run again and train for the Valencia Marathon on December 1st. He said I can get on an elliptical machine this weekend if I want in Wisconsin, for 20 minutes at a time, 20 to 30 minutes every other day to see how it goes. Icing afterwards. I can also start to walk more now, and I can put shoes back on. But I've been in recovery sandals only for the last, I've been in recovery sandals, for months now. So I'm going to very slowly start to wear shoes again, but I'm also going to focus on wearing sandals like 80% of the time, just because with my heels, I can't wear shoes very often unless maybe I'm at a wedding or a fancy event and I have to wear very comfortable dress shoes or if I'm in a situation I have to wear very comfortable shoes ever for the rest of my life because I have a sensitive heel and Achilles tendon. I have to make sure I have shoes that have a higher drop because a low drop shoe will trigger my Achilles tendonitis. So my favorite shoe is the Asics Nova Blast 4, and that's the newest one. And that's about a 12 millimeter drop. I'm gonna get a brand new pair of those so that I can, on the elliptical, I'll probably use my Asics Cumulus and then the Asics Nova Blast that I have. I'm not married to Asics. I just got a free pair of Cumulus at a work conference, and I love the Nova Blast. It's my shoe of choice, but there's other shoes I like too, and I race in a totally different shoe. But you know, it sounds like July 1st in 2 weeks, if the elliptical goes well over the next 2 weeks, and I've been swimming every day. I swam this morning half a mile, actually more than half a mile. I swam 3/4 of a mile this morning. Normally I swim a mile a day. I missed the last 2 days because of all the rain. My knee was bothering me a lot out of nowhere, so I started to take the meloxicam again, and I am going to keep swimming, and I'm going to add an elliptical, and then doing elliptical every other day for the next 2 weeks if that goes well, and walking goes well, because I haven't been walking at all except just to and from my car and my house and my office. Literally no walking more than half a block to a block because it's, you know, it can trigger inflammation. But in 2 weeks, if everything goes well, I can start running by, you know, going onto the track or a soft surface like AstroTurf and wearing very cushioned shoes with a high drop and just really gentle running, guys. So I'm not going to be running 5-minute miles anytime soon, but that's okay. You know, it's a long road back. You know, the 5-minute miles can come in November, you know, a month before Valencia. They can come in October, 2 months before, and October is still a long ways away. So if I can start running again July 1st, you know, it'll be 10 miles a week for the first week or two, and then eventually I can work up, you know, 5 or 10 miles a week and get back to 30 miles a week, which is so baseline, you know, but that's light years away from where I've been the last 2 months. I haven't run in 9 weeks, literally. The last run I did was April 7th or 6th. So I'm really excited to hopefully July 1st get back out there running and hopefully be able to do Valencia. I also want to do Boston next year in April, and I can register for that in September because I'm already qualified from last year's Boston and Chicago. And then I also am going to do hopefully the Flanagan's Rocking Rib Run in November, and also there's one more race after Boston. Gosh, I forgot. But regardless, the big one is Valencia, December 1st, 3 days before my 46th birthday. I would love to race a marathon in 2024. I did 3 or 4 last year in 2023, and, you know, I had to take the last, you know, I've been off since January. I've been off since November. Basically, I was just running like 30 miles a week. You guys can see my allergies. Anyways, this is a good progress report today from my doctor, my surgeon, and my physical therapist. They all said my Achilles looks a lot better, a lot better. And I'm making a lot of progress, and that they're happy to see that I can do the things I'm doing. I can stand on my toes, and I can do some strength training now, they said. So do strength training, do rehab, keep swimming, and do elliptical, and ice it. I'm gonna be icing a lot. So guys, it was great catching up with you. I'm gonna let you go. It's a quicker video. Not much else to say right now. I'm going to Madison, Wisconsin tomorrow morning for 4 days to see my family for my mom's 75th birthday and Father's Day weekend. I'll be in Madison, Wisconsin. I'll be coming to you live on Sunday for a garden tour from Madison, and I'll take my camera with to Madison. I'm bringing a professional camera up there to take some pictures of the prairies and the woods that I'll be walking and the gardens. And so I'll talk to you soon, guys. My battery's about to die. I'm gonna let you go. I hope everyone's doing well out there. Happy Father's Day weekend to all fathers. And yeah, thanks for caring about my injury. It's a long road back. I mean, I don't know what to say at this point. I'm just dealing with a lot of struggles, from allergies to knee issue now out of nowhere. I'm going to be getting an MRI in a week and a half on my knees, so we're just going to, out of an abundance of caution, I'm going to get an MRI just to see what is going on inside that knee, why I have so much. It could be that my bursa has some inflammation or irritation, or it could be, we don't know, but the bottom line is it's probably not a big issue. We're just out of an abundance of caution going to get an MRI on the knee. My doctor gave me an order for an MRI today, so I'm going to get an MRI next week when I get back to Florida, and I'll let you guys know how that progresses. But in the meantime, I can get on the elliptical. I just need to manage the knee inflammation, which is most likely patellar tendonitis. So if anyone's had that, that it's something you can manage, and I'm not ready to be put to the horse, glue factory yet. So hopefully never. We got to be able to walk. If we can't walk, that's pretty hard, on someone to not be able to walk or to exercise. So, that's why, it's really important that we take our health seriously and preventative care, and just also listen to our bodies. When we need to take a break, take a break. I've been trying my hardest to rest for the last 2.5 months. And thank you guys again for caring, for tuning in. I'll be back on Sunday with more information, and let me know if you have any questions about Hagelin's deformity, Achilles tendonitis, 10X surgery, PRP injections, physical therapy, strength training, you name it, nutrition, everything. It's been a huge learning curve, and now I know so much more than I did a year ago. And this injury is 5 to 7 years old, so imagine if I had taken it seriously when it started. All right, guys, I'll talk to you later. Have a good weekend, everyone. Much love.